Hello, my name is Megan Filipowitz, and today we will be discussing breast cancer. This is for my nursing course at Indiana State University with my instructor, Dr. Lucky. The objectives for this PowerPoint will be to determine who is at risk for breast cancer, to define what breast cancer is, to list the signs and symptoms of breast cancer, to discover common risk factors for breast cancer, list resources for more information about breast cancer, determine treatment for breast cancer, and educate on ways to decrease your risk. At this time, if you would please look in the description, there should be a link. Please take the pre-test now. This is to gauge your current knowledge on breast cancer, and you can review the answers after you finish the test, and then continue on with this PowerPoint. So what is breast cancer? Breast cancer is when tissue in your breast begins to grow out of control and form a tumor. This tumor continues to grow and can even spread throughout the body through metastasis. Cancer is a very serious condition and can only be treated after being diagnosed. Cancer may even lead to death. It is important to determine your risk in order to determine the steps necessary to help prevent cancer. So what are some signs and symptoms of breast cancer? A lump in the breast tissue. This can be in one or both breasts, and most of the time is described as not being painful. Swelling in the breasts is another sign and symptom, as well as breast or nipple pain, nipple discharge besides breast milk, nipple retraction, where the nipple pulls itself into your breast and is no longer pointed out. Redness around the nipple and breast may also be another sign and symptom of breast cancer. If you have any of these, it is important to speak to your provider to get tests done and be evaluated for your risk for breast cancer. So what are some risk factors for breast cancer? Gender, being female, increases your risk for developing breast cancer, although there are some severely rare cases of breast cancer being developed in males. Since males do still have tissue that is similar to breast tissue, it is still a possibility, although extremely rare. Genetics is another risk factor, one of those being the BRCA gene. It is important if anyone in your family has had breast cancer or any other form of cancer to possibly get genetic testing to determine if you have this gene or not, as this may increase your risk of developing breast cancer. And again, family history. If anyone in your family has had any form of breast, ovarian, or any other cancer, this can increase your risk of developing breast cancer. Having dense breast tissue is another risk factor that can increase your risk for developing breast cancer. This can be things such as having fibrous, dense breast tissue, which can be determined upon self-examination or discussion with your doctor. Age, being over 50 increases your risk of developing breast cancer. However, nowadays, most doctors' offices or insurances cover mammograms, which is one of the tests for breast cancer, before the age of 50, around 40 or 45 years old. Hormones or hormone therapy can increase your risk of developing breast cancer, and low physical activity can also increase your risk of developing breast cancer. Both hormones and low physical activity are modifiable risks that can be reduced or eliminated with exercise or proper treatment with discussion with your provider. So what are some tests that can be done to diagnose breast cancer? First off, while listed second, would be the mammogram. Mammogram is the initial testing method for determining breast cancer. After that, they can do a biopsy through ultrasound. So they take the ultrasound to your breast and then take a needle to extract some of the tissue where it is more dense, as that can indicate cancer. And then that is sent to the lab to be tested by pathology as to whether it is malignant, which means cancerous, or not. Next is also a CT scan. This is typically done after breast cancer is diagnosed, and it is done for the whole body to determine how advanced and if the cancer has spread. If the cancer has spread, it would be seen on the CT scan, not only in the initial location in the breast, but in other parts of the body, in organs, and even in your armpits where there are lymph nodes. So what are some treatment options to treat breast cancer? Although more radical, surgery is the most common way to get rid of breast cancer. There are different ways and different methods of removing the breast tissue that is cancerous, and this can be called a mastectomy. It can be called a total or partial mastectomy, and that depends on how spread the cancer is, if it is in both breasts or one. Some patients choose to remove the breast tissue of both to decrease the risk of it growing back, as well as for the look to be more even. There is always plastic surgery down the road, which can help reconstruct your breasts to a more realistic look if that is desired. However, the goal of the surgery is not for physical looks, but to treat the cancer. Another treatment method is medication. There are certain medications that they can put you on that suppress certain hormones to decrease the growth of the cancer. Radiation and chemotherapy are typically done together to help reduce the size of the tumor altogether. So at this point, you may be wondering, what are my resources after being diagnosed with breast cancer, or if I want to just find out more about breast cancer? The first resource I have listed is Healthy Women. Healthy Women has more than just information about breast cancer. It has information about any sort of disease that is related to women, whether it be hormone, menopause, endometriosis, cervical cancer, breast cancer, anything like that. So this is a good resource for not only finding more out about breast cancer, but about any other condition that is specific to women. Another resource would be cancer.org, and again, this is for more information not only about breast cancer, but any other forms of any other forms of cancer that may exist. This website gives more information about signs and symptoms, risk factors, treatment, what to look for, when to seek help with a doctor, etc. And then the last resource I have listed is the CDC, the Center for Disease Control. And again, this has more information about breast cancer, signs and symptoms, and risk factors. But the CDC does much more than give information about just breast cancer or other cancers. It basically gives more information about any other diseases that may exist within the United States. So it's a good resource for not only breast cancer, but if there's any other diseases you may come across or you've ever been diagnosed with. And that comes to the conclusion of my presentation. Here I have listed are the resources that I used for gathering the information for this presentation. And again, if you have any other questions or concerns or want to evaluate your risk factors, it's important to set up an appointment with your primary care provider to not only get more information about breast cancer, but to determine your risk, diagnose, and seek treatment for it. Thank you.